Ladies and gentlemen, today we are honored to have with us the tycoon of cooking industry, none other than Master Chef Mr. Sanjeev Kapoor, chef extraordinaire, TV show host, author of best-selling cookbooks, restaurant owner, and winner of several culinary honors. Master Chef Sanjeev Kapoor's innovations in Indian cuisine have made him a household name in India and abroad. He has the proud distinction of being the only chef in the world to have his own television channel, Food Food. He is living his dream of making Indian cuisine the number one in the world and empowering women to become more self sufficient through the power of cooking. For his contribution to Indian cuisine, he was awarded with the Padma Shri in 2017, one of India's highest civilian awards. Winner of the Best Executive Chef title in India and Mercury Gold Award at IFCA Geneva in 1993, Mr. Kapoor is credited with giving credibility and recognition to the profession of cooking in India. To ensure the health of those taking care of us during the pandemic, that is, our doctors and other healthcare professionals, is never compromised, Taj Hotels and Sanjeev Kapoor are working together to provide meals to the medical staff on duty at the hospitals. Now, without taking any more time, I would request Mr. Sanjeev Kapoor to take us through his journey and how is he making a difference in current times by serving the COVID warriors. Thank you so much, sir. Over to you.
Thank you very much. Thank you for arranging this. Good afternoon. I think this is something which is very different and new for me to be in touch like this, to talk like this. I have. I'm more comfortable being in the kitchen, more comfortable cooking, but it's always a pleasure with people and professionals from a field which at one time I probably may have joined as a kid. If that would have been the case, then probably it would have been Dr. Sanjeev Kapoor addressing today. But that was not to be. I guess each person has their own journey, and for me, it had to be different. It had to be a journey of a chef, and that's what I did. And thank you for introducing me with all the credits and superlatives that you mentioned. I must also say that today is Baisakhi, today is 13th April, and 3 years ago on same day, the award ceremony for Padma Shri was conducted at Rashtrapati Bhavan. So it was something which I must say was it was a visit to President House like no other. That was not my first visit there, but it was something which was very different. I like to share a little story from that day 3 years ago. I was asked that when you are going to the president's house to collect it, you have to be in your national dress, and that was the dress code. And I requested if I could come in my chef uniform, and they said no, this is not something which is allowed. It is something only national dress is allowed. And I said no, I would like to be in my chef's uniform. And they said, no, there is no precedence of that. I said, yeah, but then there have not been any precedence of chefs getting a Padma Shri. And that time, then they gave an example. They said, no, we have many precedences of professionals like doctors who get this Padma Shri, and they don't come in their uniform. They come in national uniform. And I said, I agree. Maybe doctors have not come in, but doctors have been getting this award for many years, but chefs have not. And I think I have a responsibility towards my profession of chefs that I want to get more recognition for this. Anyway, uh, I defied them. I went in a chef's uniform, and anyway, I got that. Not that there was any uh, resistance from their side on that day. But anyway, coming back to uh, what I've been doing with for the fraternity of medical fraternity is that when all this started and when we started hearing about coronavirus and how it would be addressed. So in city of Mumbai, I came to know that Kasturba Gandhi Hospital is something that is getting ready for it in a big way. It's not that it wasn't ready; it was always there, but that started to get attention. And though I've been living in Mumbai for almost 3 decades, but I didn't even know where Kasturba Gandhi Hospital was, and I had not even heard of that. We knew of all the other hospitals, and when more conversations started, and I don't know what, I just thought that maybe this is the time that our restaurants had closed, our offices had closed. We're sitting at home. Lockdown had started, and I realized that there are essential services where doctors and medical fraternity is there. There are cleaning people, BMC, our municipal corporation people. The essential services which are on. And how could we sit at home and not do anything? And I thought that the best would be that if we can start by maybe giving food to the hospital, supply food to the hospital. And that was a thought. I started by picking up the phone, and I called a friend of mine who heads Taj Group of Hotels. He's the MD and CEO, Puneet Chatwal, and we are batchmates and good friends. And I said, Puneet, why can we do something like this? He said, yeah, but how would we do it? None of our kitchens are open, no staff is there. How would we do it? I said, see, I have access to some staff. You can check. And he says, how would it be funded? I said, okay, what if I give 50% and rest 50% you give, and we pool in our resources and we start making and cooking some food, and we do it. And he said, "Oh, that's a good idea. Let's look at it." And that's how it started. And I had thought of Kasturba Gandhi Hospital, but I had no contacts. I had a chance meeting with Dr. Neelima Kshirsagar from ICMR a few weeks ago at Delhi airport. And I had her card, and I picked up the phone. I called her. I said, you know what, we want to give some food to hospital, Kasturba Gandhi Hospital. Do you think that they would be interested? They would be keen? And she said, okay, let me check. And she connected me with the dean there, and things fell into place, and we started supplying food. And they said, oh, there is another hospital, Seven Hill Hospital, that is getting ready for quarantine. There's Sion Hospital, there's other. And suddenly we realized that there were 3 hospitals that we were giving food in. And it just started. And by this time, Taj Group, their public service, they have a trust. They came in with more funding. Tata's contributed with lots of fund for all this activity. And then after a few days, I said that should we look at supplying food to hospitals in Delhi? And we started, I would say a week later, we started a few hospitals in Delhi. And then we started 3 hospitals in Bangalore. And few days ago, I think 4-5 days ago, I got a message from a doctor from another hospital in Bombay, Cooper Hospital, and they said that, oh, can we get food here also? We were not sure whether we were capable. We were running out of funds. Again, we tried, and Taj and Tata is being a very benevolent partner. They immediately they agreed, and today we are supplying there also. So it's been very rewarding. And other than that, I've been associated with Akshay Patra for many years now. I do a lot of work. I'm on the consultative council, and been in constant touch because we have kitchens which fulfill midday meal program all over India in different schools, different states. So those kitchens have been put into action to cook food, to give food to needy, and also make dry ration packets. And I'm very happy that every day we are monitoring that, and there are over now, I think about 16 million people who have been fed, and over 1.5 million people are being fed through different kitchens, through rations and food. So it's amazing to see that how there's so much of goodness that is there all across. And I must admit and say that whatever we do is nothing as compared to all the frontline people, especially our medical fraternity, who is being at the forefront of all of this, and amazing work that they are doing, selfless work that they have been doing. It's amazing. Hats off. There've been some interesting memes that have been doing rounds, and where it says, "Oh, temples are closed. This is closed. That is closed." But God, in form of the medical personnel, doctors, nurses, ward boys, they are still on duty. So a big thank you to all of the medical fraternity who has been doing such an amazing job. And I can say that we whatever we do, I don't think it'll be ever enough. And I think in India, the need gap that is there in our society, there are some very able people, but there are lots more not so able people. Their ability to either earn or to get food, or there's a lot of struggle. But I think as long as people who have giving nature are there, and I can tell you that I've been able to find lots of people from our fraternity, from hotels and restaurant fraternity. And today, every day, apart from medical fraternity, apart from what Akshay Patra has been doing, we've been raising some funds through family and friends and acquaintances, and making sure that we invited quite a few restaurant and caterers to cook meals at highly subsidized rates. And today, lots of food is being funded, being cooked every day, and delivered, especially in Delhi and Bombay, where I would say that I've been able to manage in these two cities more than other cities. And I'm sure that in other cities also, each city there is somebody who's doing that work. Railway police, we've been supplying food to, and they come and collect the food packets every day, and been distributing. And I've been in touch with the top police officers who've been instrumental in distributing food to poor. And it's amazing that they are working. And so it's not only that they are working under difficult conditions, yet they're also offering a helping hand to many people who cannot get food in these difficult times. So so on my part, I would say that I've been able to contribute in many different ways, though in my very small contribution as compared to what the essential services workers, and at top of that chain, I would put the medical staff. What they have been doing is remarkable, and no matter how much we praise them, would be not enough. Risking everything, uh, putting patients before uh, them, before their families, their comfort, risking all of that. I think it needs a special, not just mention, but a praise, and that's something which I think whole of humanity would remember for years to come. I can say that in this time of difficult times, especially even for medical fraternity, they need to take care of their diet. Uh, I don't think we'll be able to supply food to everyone, but my request to all the medical professionals is to take care of their health also. We are very good in giving. We believe in value of tyag, where we are willing to give ourselves up for someone else's benefit. But to be more useful, I think we need to take care, the medical staff needs to take care of themselves more. It's like on a flight, which is a rare thing now. I hear one flight a day, maybe a cargo flight, because we are on the flight path where we live. But when the oxygen mask falls, then put that medical the oxygen mask first to yourself, then to the person who may be dependent on you. So here also make sure that your nutrition is up to date. You are taking care of your immunity. You are taking as much rest as is possible. Uh, I know that that's a rare thing again for people who are providing medical services. In immunity, to take care of that, make sure that simple things like old spice box that we have, something like haldi, just consume more of it to get the better effect, the higher efficacy of curcumin and turmeric. Have it with little black pepper. That improves the bioavailability of curcumin by 10 times. I know curcumin is not soluble in water that much, so the absorption in intestine is also not that easy. So the way we cook it, spice, whenever we use haldi, is one of the first spices that we put in sequence of events in cooking, so that it dissolves in fat first. We give it more time. Even if we have it in milk, it gets dissolved in the milk fat, and you have to cook it for at least 5 minutes till you can have it. So make sure that you keep that in mind. Have vitamin C. Amla is something that's available. Make a instant pickle with it. It's something, just put some salt and haldi on it, maybe a little bit of oil, just temper it, and it's an instant pickle that you can have with a little bit of chili powder also. All season fruit and vegetables are available. All of them are good, and do pay heed to your diet and rest. It's critical. It is important. I have many doctor friends, and it's a common joke that I realize that if I was not a chef, I would have been a doctor. So many of my doctor friends do call me Dr. Kapoor, because I realize in my interaction that nutrition as part of medical, when people study this subject, nutrition is just few pages. So in today's day and age, I do end up spending a lot of time with doctors on diet for patients, and diet for doctors also. So I know that doctors also need to take care of their diet. They also, like patients, look up to doctors for their diet needs. I think doctors also need to take care of their diet and not take it for granted and not take it in a way that, oh, it is okay if I don't eat the way I should. But so my suggestion would be that make sure that that's not taken lightly. And another point I would say is that very effective thing is having hot water, but you can make tea, which you can make first thing in the morning. Make boil 1 liter of water with 1 teaspoon of dhania seed, 1 teaspoon of jeera seeds, a little bit of ginger in it, and maybe a few tulsi leaves. Boil it for about 10 minutes and strain it and put it in a thermos flask, and you can keep on sipping it throughout the day. That tea with dhania, jeera, adrak, and tulsi is something that will give more heat to the body. It increases ushna, it gives energy, it gives, and it makes sure that the agni of the body is more pronounced, and that's what you need. You need agni to be higher at this time, and that's what immunity boosting also means. So a simple step like that, convenient to do, convenient, you can keep it wherever you are in a flask, and you can easily you can have that, and it's something very well can be executed, and something which can be referred, and it's something which can be propagated more. Another thing is not very hot, but in a little bit of lime and honey in warm water, not hot water, works very well. The alkalinity lime, when we have it, it converts into alkaline medium, and honey has its own properties, antimicrobial, antiseptic. Actually, it's a great thing, and with honey works really well. So again, that's something that uh, can be done. A simple thing from our kitchen, salt can be very effective with water, gargling with that. Don't ignore the kitchen. Make sure that the kitchen is used more and prescribed more in today's day and age. Kitchen is open. Kitchen is definitely open. So I'm getting many questions that I'm getting. How to wash green vegetables and avoid COVID? So green vegetables, actually simple, from very old time. Potassium permanganate is something which has been very good. It still works. Otherwise, baking soda is something which can be used. You can create 1 teaspoon of baking soda. You take about 3 liters of water, soak that in that. Again, with salt and turmeric also, you can wash. Good thing is vegetables. They are easy because most of the time we cook them, and whatever is there, if the surface is washed and peeled, then the risk in any case is not there. And on cooking, in any case, that all is taken care. Can some arrangements be made to provide nutritious meal to resident doctors at KMS Karad? Ooh, okay. Kim's Karad. Okay. To be very honest, at this moment, the way we have planned our meals for next 1 month, all the funding that has been raised and the number of meals that we have to provide to all the hospitals, and with Cooper Hospital in Mumbai being added, I can tell you that we are full up with our capacity on this. But if we are able to raise some more funds, and we end up with more funds and our ability to reach Karad, I'll definitely keep that in mind. And Otherwise, through my network, if we can look at that, I'll definitely keep that in mind. Somebody has written, can vinegar also be used vegetables and fruit? Acidic medium, you'll need higher acidic medium than what you would have to. So better can be baking soda there. There are other ways. Scrubbing works really well, and then cooking. So that's the way. Cooking is cooking well. Cooking well is important. That's the key. And personal hygiene. I think this is for the first time. Though Swachh Bharat has been talked about, I think this is the first time people have realized the importance of washing their hands, and in kitchen, I think not taking slippers, washing your hands all the time whenever you're going. Personal hygiene, not just of yours, even after this is over, and when help starts to come in, when maids start to come in, I think their hygiene also would be critical. You need to create a protocol for that, and that protocol has to be written down, and that has to be the way we would do it in hotels and restaurants. We would say that, okay, you have to sign this every hour. Did you do this? Every time you came in, did you do this? Every hour, did you do this? And sign here. Otherwise, you'll not be paid. So create those protocols even for home. I think inform patients that they need to do that. It is important. It is critical. Dr. Idishri Pradhan from Bangalore. Okay, 8-year daughter is a big fan. Happy to see you. Happy to interact like this. Dr. Anuj Bhardwaj from Bangalore. Thank you. And what kind of diet would help to boost the morale? Actually, very, very good question. I think we need to take care. So we've heard of the hormones. We have taken. We have thought of these things, and we've been working at it. So serotonin. I think during these times, make sure that you are not denying too much, because too much is being denied. When it comes to food, make sure that not too much is denied. Cut down on the quantity of things that people may want, and they may not seem to be very nutritious, but for mental health, it is important that there is no complete ban on such things. But control the quantity, especially for kids. That is important, because that's one part I would say. Good thing is, even junk food cooked at home may not be that bad, because we are more prudent when we are cooking at home. You can relax a little bit when it comes to food, so that it gives better nutrition to the mind. It makes the state of mind happier. So keep that in mind. Can we continue eating non-veg food in COVID period, like chicken and mutton? If it is sourced right, if it is cooked right, there's no data that you should not or you cannot. I am largely a vegetarian. I turned vegetarian last year, but other than that, I think source it right. Make sure that it's coming from a good source. And non-vegetarian, in any case, you cook through, so that's it should not be a problem. World over, it's there. So yes, you can. Okay, you have limited resources. I know that. That will be a challenge. Follow our social media. We are doing a lot in our Instagram, Facebook, YouTube, our TV channel, Food. We are doing a lot of solutions. We are giving. Gargle with the alcohol. My view. Somebody has asked. Harish has asked. Gargle with alcohol. My view, I would say that the gargling effect that we would do is primarily to take care of our throat. I would still go old school, and I would go salt. I would prefer cheaper. I would go that route. Please suggest some new food recipes for diabetic patients. So diabetes, I hear one thing that I have to alert that in India, while people talk about sugar, I think salt also for diabetics needs to be controlled. Is a message that I think we need to give everyone. Medical fraternity understands and knows that, but people at large may not. I think how people understand that. Sugar or sugar things that are similar to that are not good for diabetics. Things with more fiber are good. Same way, salt needs to be controlled is an important message that needs to be given. But fruits and vegetables, all the balanced diet things work really well for diabetics, especially type 2 diabetes that is prevalent in India. That's another full topic that I can tell you on diabetes. We'll get one full session only for that. Please post cake recipes without oven at home. Okay, I'll keep that in mind. I will keep that in mind. I'll do that. What is the best binge food that's there? Whatever you can find in your kitchen, because availability, as somebody said, is poor. So whatever you can find, but binge on if you have to binge on salads, and so take cucumber if you have, little bit of salt, lime, and chaat masala. Binge on that. Fruits, papayas again, same salt, chaat masala, lemon juice on papaya. Binge on that. You can not don't binge, but yes, you can enjoy nuts. You can enjoy, but in moderation, because they're high calorie. They're high calorie, but yes, you could do that, and yeah. So in current situation, many people are suffering from cough and cold. I said that hot water with ginger and tulsi, or just a simple tea made with the four ingredients that I said. They are very good. Honey and ginger juice. Keep on taking very small quantities. After some time, it will take care of the cough. These are home remedies which have always been there. Licorice, mulatti, jeshtimat, as we call. Chew on that. Very soothing, very good for throat. In Ayurveda, a lot of it is taught. One more thing I must tell you for immunity boosting, chavan prash that we have. The base ingredient for that is essentially amla, but it has other ingredients which Ushna, the Agni of the body increases with that. So again, Chavanprash is good. Please give some soup recipes. I'm going to do a sweet potato and corn chowder with a little bit of chili tonight. So that's a soup that you can do. Okay. Any other kesaria kheer recipe? I want kesaria kheer. I thought I showed that, but no, maybe I talked about it today with somebody. Okay, I'll keep that in mind. Just make kheer and add kesar to it. That's kesaria kheer. Kheer is made with rice and milk and sugar. That's it. Very simple. You want to add sugar free sugar substitute to that. You can do that. There's natural sugar substitute made with stevia. You can use that. Would it taste the same? See, it is not the same. It may not, but it does the work. So keep that in mind. In is lemongrass in kadai with jeera, dhania, and tulsi useful? Oh, in kala. Okay, lemongrass. Yes, even that's a good, very good herb. Yes, you could add that. Lemongrass is very fragrant, very flavorful. Yes, you could use that. How to make mojito? Wait for some time. Mojito, good mojito, would need lots of ice. So I would recommend for some time stay away from chilled water, cold water, iced water, anything which may not be good for your throat. May be avoided. May be avoided. Okay, one more fan. Thank you, Dr. Sanjeev Khanna. Okay, if it is Dr. Sanjeev Khanna, one Dr. Sanjeev Khanna I know, who's a gastroenterologist, who's a dear friend. If that is him, big hello, Dr. Khanna. my view on traditional Indian probiotics like lassi, chas, fermented. Oh, I think fermented foods we underplay. We need to talk more. I think gut work needs to be talked more. Since it's gut, I guess that it's my friend Dr. Khanna here. Yes, more gut discussion have to happen. The microbiota in our gut needs more discussion. Doctors have been talking. Another doctor friend that I have, our cardiologist, Dr. Prakash Sansgiri, and he keeps on sending me a lot of stuff on the research that is done in the medical world on microbiota of the gut. Yes, Indian lassi, homemade dahi, the probiotic count is much more than the probiotic count of the probiotic curd that is available in the market. So set your curd at home. Much better. We have okay. Yes, I've got Dr. Khanna's comment here. Yes, good to be with you, Dr. Khanna. Thank you very much. Okay, food and drink. What food or drink will reduce weight? Actually, food and drink to anything that you do in moderation is good for you. High calorie food would not be good if you want to reduce your foods which give you more fiber, which are more fulfilling, which are low in calorie, which stay in your intestine longer, would help you to reduce weight. But with that, increase your physical activity also. Please make sure that you increase your physical activity. That's something that is important. Make sure that you can walk inside your house. I just read that somebody in the balcony did a full 42-kilometer marathon during this period. It's not over in one day. That's it. In balcony. So you can imagine. So what is 42 kilometers, and what if even if you were to do 4-5 in a day every day, it's possible. Weight is the easiest thing. The other thing, one more tip I can give you: if you want to reduce weight, start throwing your weight around. It's a joke, but never mind. Okay, thank you very much. I know that there are many questions that is washing fruits and vegetables with the soapy water advised? I would say baking soda does the trick. That's something in commercial establishments and many households. I don't know now, but I was talking to my brother. He says, "Yeah, potassium permanent KMNO4, what we read, right? It still can work really well, but we underplay baking soda as a disinfectant. It's a very good quality disinfectant, especially for kitchen. So one, it's edible, and it's a disinfectant. So use that. Keep it handy, always in your kitchen. It's something which most people ignore. Don't even know that it's a great disinfectant. So that's something. And if you realize soap and baking soda, what is common? Both are alkaline in nature. That's what you need. High alkaline medium is good for disinfection. That's what we do here. And for kitchen disinfection, I'm talking about. How do you disinfectant? Okay, I have a message here that Surbit will ask a few questions. So maybe we'll take a few questions from him. And how much baking soda should be used? As I said, that 1 teaspoon in about 2 liters of water is good enough. Okay, so Surbit, you want to start with questions?
Yeah.
Right, yeah.
Thank you so much, sir. First of all, so glad to have you with us today, and thanks for taking so many questions from our such a participative and keen audience. Yeah. So here I go. First of all, what precautions are you currently taking to sanitize food utensils and parcels? Because it's a time of safety is the utmost thing.
Right, of course. So first and foremost, so let's look at the essentials that We currently, the way we are dealing, unfortunately, I have some specialty equipment also. So
Okay.
I have a company, Wonder Chef, and we have been looking at creating a oven for disinfection, and we've been working at it. For me, it's different, but I would say that one cannot talk enough about. So one is that coronavirus related scare that may be there. One is a general hygiene that is there, which is of the kitchen, disinfection of floors, tiles, walls, and then also of the ingredients, packets, right? Each needs to be treated differently, looking at how it can be dealt with. There are certain things that can be washed with the soapy water. That's easy. You can do that, but you don't want to do that with fruits and vegetables. They need to be treated there. That's where I said that an alkaline medium created with baking soda is very good. For vegetables, salt, high salt and turmeric is something which is traditional we used to do, and especially because vegetables have to be cooked. Most of the vegetables, we cook them more than. So remember that during this time, cook your things, whatever you are eating, cook them through, vegetarian or non-vegetarian, does not matter. Make sure they are cooked through. So that is important. How do you take care of the green vegetables, green leafy vegetables? Uh, Wash them in salt water, in thorough salted water, and again cook them through. Even if you are using curry leaves, in tempering, cook them through. Things like coriander, things like mint, which you are using as raw, or salad leaf. There, I would go the route of baking soda. I would go there in a concentrated baking soda, maybe 2 teaspoons, which I'm going to consume raw. There, I'll be careful more. That's how I would treat. Personal hygiene, again, I would be very careful with. Temperatures, I would be very careful with. I would cook things through. I cannot talk enough about this, because that's something. And reheating. Remember, while reheating may sound as something, oh, now there is no issue of, it's not about only corona. You don't want to have any issue, not just COVID issue. It is over general health, because the conditions are difficult, things are not available. Medical help is needed for a cause. So you want to fall sick much less than what people, so we cannot afford to fall sick. So make sure that overall hygiene is maintained, overall health is maintained. So even on reheating, reheat the food thoroughly. Don't just reheat half and say, oh, this is, so reheat thoroughly. Yes, Survey.
Yeah, sir.
Yeah.
So there's one request from the little one, I think Dr. Rajesh from Gujarat.
Uh-huh.
So he says that they are expecting one. Can you please suggest one palatable recipe for a little patient as an alternative to the junk food?
Okay, so is there any specific problem, or is there anything which is there? No.
So that's not mentioned actually. Yeah.
Okay, so I would suggest that do a nice pizza. There no issues. Do it home style, and create a base. You don't need to work with maida. You can create a base with a mix of different attas. You can create a base using atta, which is whole meal atta, गेहूं का आटा. You can add some ragi flour to it. You can, whatever you have jawar, bajra, create a base with that. naturally follow the recipe of base for whole wheat, uh, because you may not find the recipe that I am saying. It will need some yeast. It will need some. It will need salt and sugar, and you need to ferment it and make it like a thick roti. You can cook it on tawa, and for the sauce or base sauce for that, make a puree of vegetables. Use red vegetables more, red pepper, carrots, tomatoes, so that it looks red, because that's what people are used to. But you are making it healthy, make it tasty. You can add a little bit of spices to it. There's no harm in adding spices, and then top it with things that are light, and on top of it add some cheese on top, and make it. There's nothing wrong with cheese. There's nothing wrong with pizza. It's just that how it is made. So let me tell you, when you buy a store-made pizza, you don't even want to know how much of fat that goes in the base of the pizza. You don't want to know. As a chef, I can tell you that at home, you will not even think that that much of fat can be used. So make it at home. Make a home style pizza. Make it tasty, and it's something that keep keep people happy.
Great, sir. Thank you. Then we have, so far we have known that olive oil is healthier. Okay. And Neela asked this question, but her mom insists on desi ghee.
Uh-huh.
So please guide which out of the two is healthier and easier to burn.
So understand that both ghee and olive oil, or any oil for that matter, when it comes to calories, all will be same. 1 gram will give you 9 calories. It's not the calories; it's the type of fat. So for India, I would say that where you are, you should consume fat of that area. If you come from a region where there is more sesame, eat sesame oil. If you come from an area where there is more mustard, eat mustard. If you come from an area where you are in an area where there's more coconut, eat more coconut, eat more local. Your body adapts best to that ingredient. One. Two, in moderation, that is important. There's enough data that he may not be as bad as what most people make out it to be, especially when we make it at home. The way we make it at home is that we take malai, we keep on collecting it, and then it gets fermented. The way dahi doodh se jab dahi banate hain, we make dahi out of milk, it's fermented. That's how then you churn it and make butter. That fermentation changes, there are certain enzymic changes that happen to the structure. It's like milk and yogurt, they're same ingredient, it's just the fermentation, right? So same way, those enzymic changes make it very, very good quality fat, and there's enough data. So I would say, whether you are eating olive oil, whether you are eating desi ghee, moderation is the key. Both will give you same calories. Both, if you eat too much of, you can put on weight, because you need to burn that if you have excess fat. So moderation, moderation, moderation.
All right, sir. Moving on. So the people, they are, curious to know that what are the dishes which are being served to the hospitals, healthcare professionals through your endeavor.
Sure. So we are we keep on changing the menu, and it's the main meal which we are giving, and in that we give a vegetable and a rice dish. We give a snack, and we give a bread and a juice. At times we give yogurt. At times we give fruit yogurt. At times we give fruit also. So there's a changing menu that is there, and in different hospitals, because now we've been doing it for some time, there are certain recommendations, because like anywhere else, like home, fatigue sets in. So we try and take care of the fatigue that's there, and it's something that keeps on changing. And we've been, I would say, been fortunate that we've got very good response from the hospitals and doctors. They've been liking it's made in very, very hygienic conditions with high quality ingredient by best professionals at Taj Sats is the flight kitchen. So where all it's the safest food that anyone can prepare is what I can tell you, and with very high quality ingredients, and we take care of a fact that it is tasty, it's nutritious, and we try and see that the fatigue does not set in.
Yes, thank you for that, sir. So, sir, we have a lot of bachelor young doctors who are kind of whose movement is restricted these days, right? So they want to learn. If you can please suggest some quick snack kind of thing for their breakfast or anything.
So, fortunately, there are many things that can be made, and if you keep at home things like poha, if you have some rava, suji, they can be made in many different ways. And if for a newcomer, it would be advisable that they follow the recipes that we have all over. They are freely available because initially I just don't want to give a small simple recipe here, but I would say that take advantage of all the recipes that we have available all across our social media, our TV channel, Food, and get the uh, get the benefit of that. There are many options that are available.
Great, sir. So this may go as a bouncer, but still I'll ask: who cooks food in your home, sir?
Oh my God! I thought that this is a question that I would not be asked during lockdown, but this is a question that I am asked every day, no matter which part of the world I am in.
I'm sure.
So this is so my wife is raising her hands here. She's here, and yeah. So anyone who cooks very good food should cook food. She cooks much better food as compared to me. So she cooks. No, actually in our house there is no rule. All of
Yeah.
us cook. Like for lunch, my mom cooked the curry. My wife made she made shikhand today. I think dinner would be because today was Monday, so there's a lot of work that was piled up. So, I think dinner would be my turn. But we also have maids who cook. They're very good. So yes, it's everyone cooks in our house.
I'm sure. Thank you so much for responding to that. Thank you, sir. So maybe I'll ask two last questions.
No.
Uh, what advice do you have for a woman who at home is aspiring to start a cooking business? Any expert tips from your end?
Okay. So I would say that I know that there are many women who are very good cooks, and this may be the best time to start a cooking business if they can cook. They
Indeed.
can start by making things that they are good with. One, start by making things that can last longer, where the shelf life is longer. Things like chutneys, pickles, biscuits, things that last longer. Start with that, and these are the times when you can call up delivery people like Zomato and register with them and list on their site. They are delivering many home style products today. And also, my advice would be start with your strength. Start with something which you can do well. Start with things that you can be consistent with. Something
Yeah.
that you would not get bored of. Something that you would enjoy. Uh, First thing is that things that you enjoy. you don't mind doing that over and over again. Because then if you want to create a business, then it is not something that you just do it one day and then say, oh no, now I don't want to do it. So it is has to be habit forming. Second, understand costs. Cost is not only cost of ingredients. So let's say your cost of ingredient was 100 rupees.
Yeah.
And you say, oh, now I'll charge 20% profit and sell it for 120. No, no. There's cost of effort, there's cost of fuel, there are many cost of packaging, cost of your time. Okay. So cost all that and then look at, is there any competition that is there, at what rate competition is selling the comparable product, and then price it accordingly. So understand that understanding of money is important in business. So understand that part also, and then start. Just start. Don't wait for perfection. Start now.
Great, absolutely. So one last question.
Sure.
Top 3 recipes or dishes close to your heart, all time.
Oh, top three dishes. I would say one is something that I can eat. I can eat a dosa every day. Okay, that's something that I can eat anytime, any day, every day. A masala dosa. My wife cooks that very well. One. Two, a Punjabi curry is something that
Yeah.
I can eat. And third, I would leave that as an open dish. Anyone who can give me anything with a lot of love and a smile would become my favorite dish for that moment, that time.
Great. I think we couldn't have asked for more from you, sir. It was such a lovely, 60 minutes, I would say. And I was impressed with the kind of questions you have been asked by the participative audience.
Yes.
So great. And first of all, thank you for sparing your time. I know you are busy. Being at home also, you are busy and engaged with so many other things. So with this, on behalf of Dr. Reddy's, I thank our esteemed speaker, Master Chef Sanjeev Kapoor, and all the participants for taking their time out. And we wish all your days be full of positivity, good health, because good health can't wait. Stay home, stay safe, and Jai Hind.